Today I will talk about planning of a hospital. This is part of my series of lectures on hospital management. This is my lecture outline. First I will give introduction, followed by brief functions of a hospital. Then I will talk about dimensions of care in hospital, followed by hospital planning and designing, emerging issues and changing scenarios of hospital services, factors deciding scope of services, factors affecting strategies formulation, strategic essentials, and finally steps in planning. Unlike other organizations which may be built in various ways, hospital building has lesser choices. This is due to complexity of functional relationship between various departments of hospital. So there is limitation in the options of building design. Functions of a hospital include outpatient care, inpatient care, emergency care, maternity care, ambulatory care, preventive and promotive care, rehabilitative care, disaster management, mortuary services, teaching and training, and research activity. All these are functions of a hospital. In hospital, there is a healthcare provider. Healthcare provider, along with process and technology, fulfill the need of healthcare seeker. These are the dimensions of care in hospital. There is a clinical and a paraclinical care. There is hospitality care, and there is administrative services. If proper hospital designing is not done, it will have deep repercussions on its functioning. So first of all, we plan a hospital, then we design a hospital, and both these affect hospital functioning and hospital maintenance. And hospital maintenance include maintenance of building, maintenance of equipment, and manpower management, which include training and development and attrition prevention. What are the emerging issues in hospital industry or hospital care? There is enhanced expectation of patients. Patients are more conscious about quality and they are price sensitive. Epidemiological and demographic changes, that is emergence of lifestyle diseases and geriatric health issues. Emphasis on ambulatory and day care, including high dependency patient care and shorter stay in hospitals. Enhanced international standards in hospital industry, changing functions of hospital from curative, preventive, research, and community outreach. There is more emphasis on health insurance nowadays, and there are advancement in medical science. There are newer treatment modalities which require spatially controlled environment. This should be taken in consideration while planning and designing a hospital. Some of the services are nowadays outsourced, which include laundry services, kitchen services, CSSD services, security services, multitask worker and housekeeping services. There may be decentralization of healthcare services. Healthcare services are now more closer to patients. These are the changing scenario of hospital services. Nowadays, more emphasis is there on daycare facilities and home care facilities, including transmural care, assisted living, physical abilities, and healthcare hotels. This is the concept nowadays of hospital industry. What are the factors which decide scope of services? Most important factor is healthcare need of the community in which hospital is situated, and the other is financial considerations. Factors affecting strategies formulation include health profile of the region, culture and socio-economic profile of the community, local regulations, budget and sources of finance, choice of technology, and climate zones. So, what are the strategic essentials? One is regionalization to avoid unequal hospital coverage. So, healthcare should include primary care, secondary care, and tertiary care. There should be design flexibility and expandability by using universal space modules, modular design, interchangeable components, that is adaptable design. We should focus on patients. There should be safety and security concern of patients. There should be focus on cleanliness and physical comfort. We should emphasize on energy conservation. I will talk about more on energy conservation and green construction or green buildings and intelligent buildings. There should be a healing architecture including cheerful environment and touch of sun, earth, wind, and water. This should be considered while designing the hospital building. Then aesthetic requisites include psychological aesthetics, that is happiness and joy, spiritual aesthetics, that is peace and hope, physical aesthetics, that is ease and convenience, intellectual aesthetics, that is contemplative delight. Then design for infection control is important. There should be concept of zoning. There should be proper ventilation and airflow. There should be isolation rooms. The ICUs, CCUs, and OT, that is intensive care or coronary care and operation theater, should be away from general hospital traffic. There should be adequate hand washing facilities and presence of air curtains. Hospital as a social institution. There is requirement of patients, staff, visitors, family members. Requirement of all these stakeholders should be considered. Then there should be barrier-free environment for disabled. Points to consider while hospital planning include location of hospital or site of hospital. I will talk more in detail on location in my next lecture on designing of hospital. The number of beds, this should be considered while planning. I will talk more about it in my next lecture on hospital design. List of services to be offered. We have already seen that it depends on the healthcare need of the community and financial aspect of the, then architectural features, design and architectural brief. This I will talk about in my next lecture. So these are the points we need to consider while planning a hospital. Then steps in planning include need assessment, feasibility report, architect brief, request for proposal, appointment of consultant, detailed project report, notice inviting tender, award of work, and then construction. Following this, there is a phase of equipment purchase and manpower selection, that is recruitment of manpower, recruitment and selection. And finally, commissioning of hospital. I have a separate lecture on commissioning of hospital. So this is all for today. Thank you very much.